now we're going to do inner cannula cleaning. There's a lot of different kinds of inner cannulas. Some are disposable, which you just take out and throw in the garbage, and then some have to be cleaned. Patients sometimes, if they go home with tracheostomies, they'll just run it under the kitchen sink, but of course in the hospital we have so many germs and boogers here that are pretty resistant to everything. We want to clean them as sterilely as possible in the hospital. So I have suctioned him already, which you will check off on suctioning. You will not check off on inner cannula cleaning, but you may have to do it in the hospital. And the policies are different in every hospital. Some use saline, some don't. Some use alcohol, some don't. So you would actually ultimately have to go by the policy at the hospital, but I'm going to show you basically how you would do it. So I've washed my hands, and I'm going to put on some regular gloves right fast. Because what you would need to do is loosen the cannula, because you have to get it out one-handed, because one hand will be sterile and you can't do it if it's locked. So this inner cannula unlocks by just turning it to the left, and then it will slide out one-handed. What you do not want to ever touch, if you can help it, is this long cannulated part of it. Cannulas go back in by going from the side and just turning really gently toward the chest. So we're going to leave that on so I can get it off one-handedly. Put his little oxygen back on him. And then I'm going to open my trach care set. Also, what you should do is go ahead and open your peroxide. Turn the caps off that. And saline. And you can go ahead and get sterile. What you have to remember here is that your sterile hand is going to be the one that goes into your field to get out all of your equipment. The other hand will do everything else. So I'm going to get my little drape here, and I'm going to open it up. And actually there's two in this kit, so I'm going to put this one on his chest. And I'm going to open this one onto the table here, I guess. What we're going to do is we're going to take out all of the things in the kit here, and we're going to just separate them onto this table, because your sterile hand is going to be the one going into the field to get the materials that you're going to use, and your other hand will do everything else. So I'm going to also separate the boxes. Some of your kits do not have 3 boxes in them. So since this one has 3, what we're going to do is we're going to pour peroxide. This is going to be my dirty hand now. Okay. Pour peroxide in my right one. In this big one, I would have liked to have done it with the other hand, but since I've dirtied this one, I'm going to keep it dirty. Peroxide in the big one, saline in the middle one, and half and half peroxide, half saline in this one. Okay, so this is my dirty hand. So with my dirty hand, I am going to take out his cannula, and I'm going to drop it into the peroxide to let it sit. So with my, I'm going to let it sit there for a second. If it needed some jiggling around or something with my dirty hand, I could, jiggle it around a little bit if it needs some washing. So with my dirty hand, I'm going to reach in and I'm going to grab my cannula. And I'm going to, with my sterile hand, go in here and I'm going to clean it. I would do it over a garbage can. You just don't want to push snot all over the floor or boogers all over the floor. Do it over a garbage can. Scrub, 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 scrub. Scrub it however you want with whatever you want. Whatever you use would go in the garbage. Then you would drop it into the saline to rinse. There we go. Let it rinse for a second. With your dirty hand, you're going to go back in and grab the end of it. With your sterile hand, you're going to get whatever you want to clean it. You clean the outside. You clean the inside. You clean it all. Alright, garbage. Then what we're going to do is it just rinse in saline. We're going to dry it off. So with our sterile hand, we're going to grab a 4x4. We're going to lay it into the 4x4 to dry it off. And then I'm going to change hands so I can put it back in with my dominant hand. But it's still sterile because I got the sterile gauze around it. Garbage. Then I'm going to put it back in. I'm going to turn from the side toward the chest and then make sure it is locked. Now what I'm going to do is I'm going to clean the skin underneath the tracheostomy. You're looking for any skin breakdown, any rashes, and you want to report those to the doctor. So the neck is a dirty area. You can use whatever you want to clean it. That's what the half and half is for. So you can use a Q-tip. And what you're really doing is you're getting the skin. So you're getting underneath the appliance here, and you're cleaning the skin off, scrubbing, garbage. Use whatever you need. Sometimes there's a lot there. Sometimes there's nothing there. But whatever you use, you really want to make sure the last thing you use is saline, because peroxide will dry out the skin, cause breakdown. So we can dip in the saline and wipe it off underneath here, and then we want to dry it. That place underneath there stays really moist and wet, and so you want it to be as dry as possible. So what we're going to do now is we're going to put in a drain sponge to offer a little bit of cushion, because this little appliance here can cause a lot of skin breakdown. So all you do is slide this under one side, slide it underneath the other side, pull it through straight, and put your tray collar back on him. What you don't want to do, if you don't have a drain sponge, which is already the pre-cut one, you never want to cut one to make a drain sponge, because all of the little frays could get sucked down the stoma. So if you don't have a drain sponge, what you can do is you can fold one 4x4 like this and slide it under one side, and then you can get you another 4x4 and fold it and slide it underneath the other side. You would document what the skin looks like underneath there, what size cannula he has, and that is trach.